Good morning. This is Technical Sergeant Shelley Corbin. I'm a member of the Ohio National Guard Counter-Drug Task Force, and I work as a civil operator here at Prevention Action Alliance to bridge the gap between coalitions and state resources. Today, we are doing our webinar on advocacy, and we have Marcie Seidel, our Executive Director of Prevention Action Alliance, here to give you the information as well as take questions at any time. I welcome Marcie Seidel.
Thank you, Shelley. And good morning to everyone. I hope everyone's having a great April day. I don't know where you are, but it's still a little cool in Columbus, and we're looking forward to it warming up maybe by the end of the week, and very much looking forward to that. Wanted to, first of all, let you know that the legislature was out all last week because of the Easter break. They are back in session now and will be very, very active from now until June, and actually through June. After June, they will go into a midterm election sort of mode where they will be not in Columbus at that point, but back in their districts working on their midterm elections. The end of the year will be the end of this General Assembly. The 132nd General Assembly will come to an end, and we'll be moving into in December what they will call the lame duck session. So there will be whatever's left over as far as bills that are hanging out there. They'll come in and handle those very, very quickly as they move on to the end of the session. And then we start anew in January. So we'll have a new session in January. All the bills that have been pending will go away, and many of them will be reintroduced if they have not been handled in this General Assembly. So it's a kind of an interesting, exciting time. We'll have new legislators, we'll have returning legislators, but we won't know exactly who until the end of the election in November. We, though, now are starting at a statewide level, and it's certainly here at Prevention Action Line, taking a look at the prevention strategies that we need to bring forth to what will be a new General Assembly and to a new administration as we get a new governor. Lots of things are important to get on their radar immediately as they come into their public office, and so we're working now on that document and looking at the types of things that need to be done. So if you have something that you are interested in that needs to be communicated and looked at to our new coming elected officials, please reach out to me and let me know. As I said, we're continuing to work on that now. There are just a couple of bills that I want to highlight, and they're not maybe traditionally ones that we in our field would want to take a look at. But as I've been working more and more in this area, I find out how inclusive we need to be looking at the entire health spectrum as far as prevention is concerned. And the one bill that I want to bring to your attention is Senate Bill 287, which is the Health Education Standards Bill. In this bill, the purpose is to develop health curriculum standards for K through 12 here in Ohio. This would be a framework for educators in districts that they can resource and go to, understand what the specific needs are within that curriculum. And this curriculum will be more of a promote health and enhancing the behaviors of our students. Ohio is the only state in the nation that doesn't have such guidance. Everyone else has health curriculum standards for their school systems, but not Ohio. And the Health Policy Institute of Ohio, back about a year plus ago, took a look at and did a study for the administration about where the status of the health was in Ohio. And one of the things that we found out and brought home very clearly was that the composite measure of health for the folks in Ohio only ranks 43rd. And out of 50 states, that's not something to be very proud of. So I think all of us need to take a look at how our health and our wellness play into not only a person's physical health, but also into their mental health and into into addiction and dependency and the misuse of drugs. So it's all very important. Right now, the statute for health in the state of Ohio basically just says that we need to be concentrating on nutrition and exercise. That's what we need to do. But several bills have been introduced along the way to encourage the school districts to include them. And one of them was House Bill, I believe it was 367, which had to do with the drug and opiate education piece. That happened back in, I believe, 2014. And so that bill's in place, but there's no mechanism or structure as to what should be the right evidence-based processes to put it into place. So this bill, in my opinion, and many of that I work with at the statewide level, seems like something that's very important for us to be taking a look at and to encourage to have passed. At this point, the bill has only been introduced. It has not been, and that was introduced on the 29th of March. It has not been signed to a committee yet, so hopefully it will be signed to a committee soon. But the thing that we're concerned about is that we know that partisanship plays in many of our pieces at every level of government. This was introduced by someone whose party is not in power at this point in time, and sometimes those bills aren't seriously looked at. So if this is something that you think is important, you may want to reach out to your legislators and tell them that you think it's important as well. Also at this point, I want to say that if at any time for any bill that we talk about or that you see on a legislative update that you feel that you would like to weigh in on or have an opportunity to testify in front of a committee or the legislature, I've put now on the weekly update a link to the form, what's called a witness form, and that you would fill that out and do it. Please, if you feel like you want to do this, feel free to reach out to us. We can give you more information about the specific time or date and location of hearings on these different bills. We can help walk you through filling out the form. We can help outline the protocol of what the protocol is for testifying, and be glad to help you in that process. So feel free to think of something that you'll have support here in helping you get through that process if you feel there's something that's just really important for you to weigh in at the legislature. Okay, the next slide here. The other bill that I kind of want to bring to your, or I do want to bring to your attention, that is kind of out of our normal bailiwick, is House Bill 546, which is Telemedicine. This bill is to protect the health benefit plans from treating telemedicine services differently than from in-person health care services solely because they provided at a telemedicine services. I think this bill is worth watching and to understanding what's happening in this, because we know that in many underserved communities and rural communities and remote communities, there isn't the same level of health care that we get in the more populated areas. So this bill is important for those who are in those communities, and then it would seem to be a disservice to them if their health services would not, or their health insurance would not pay for these services when they're so badly needed, and this might be the only way they can to access different health care needs. So we're going to be taking a look at this bill, and we'll be watching it closely to see how it goes through the legislature. It was introduced on March 13th. It was assigned to the House Health Committee, and actually its first hearing, I believe, is Wednesday, tomorrow. So at that time, it would be for first hearings. It's usually, and it's always the sponsor testimony. So we'll get a good read on what the sponsor is thinking and the importance that the sponsor is placing on this type of legislation. So that will be taking place really soon, and we'll keep you updated on that one as well. The next thing that I'd like to talk about is that I sit on the Medical Marijuana Advisory Committee, which is comprised of 15 individuals that will advise the process of setting up the Ohio Medical Marijuana Control Program here in the state of Ohio. We met last Thursday, and I felt it was important to give to give some updates as to what's happening with this really important piece of law. As we know, House Bill 523 was passed on September 8th, 2016, and it is required to be in operation by 2018, September 8th. It's coming upon us very, very quickly. We were given very clearly at this particular meeting last Thursday that this bill will not be fully operational. Well, it'll be fully operational, but not to full capacity on September 8th. So while whoever is able and qualified to receive a recommendation from a physician to get medical marijuana or regulated marijuana, as many call it, that they will be able to get it, but it may not be in all of the different venues that we had hoped for, like the 60 different dispensaries. Some will be open, and some will have the materials and the process marijuana that they can get, but we won't have the full range of everything that will happen as the bill, the implementation of this law goes forward. So they were very clear about it, that will be operational, but not at full capacity, just to make sure that the expectations for that are clear and we've set them properly. Cultivators have had some very interesting problems along the way. There are 24 provisional licenses for cultivators, 12 large ones, 12 smaller ones. Those 24 were selected from a pool of 184 applications. Currently, there are 70 appeals that the process was not fair. That's in the process now in the state of Ohio, going through the appropriate appeal process. There is one lawsuit indicating that they don't believe that the minority set aside for businesses of minority businesses was appropriate and legal, and so that's going through the Franklin County court system right now. And then there is one cultivator who applicant who for the cultivation who feels that the process wasn't fair, and he's just going to initiate a ballot initiative. Now, right now we're understanding that while that was laid out there that he was going to do that, we're understanding that there's not money to follow that, and there's not a coalition bill to make that happen. So we're not sure whether that's going to happen or not, but that's something we always need to take a look at, is that there are a lot of people who don't want to go through this very precise process for selling regulated marijuana, and the ballot initiatives is always an alternative. The Attorney General's office is looking at a third-party evaluator who will come in and look at the process that the Department of Commerce used to select the cultivators, since there's such a clamor that the process wasn't completely fair and appropriate. So that third-party evaluator will be coming in to take a look at the process. However, the Department of Commerce stands by the fact that they believe that what they did was fair and adequate, and it followed all the regulations and the rules that were set forth, and felt that they did a good process. So their charge is to make sure that the law is met, and that the process will lead to full implementation on September 8th. And so they're continuing to move forward while all these things are going behind the scenes. The processors is another piece now that we'll update on. And again, this is the Department of Commerce that oversees that. There will be 40 selected in the state of Ohio from 104 applications. That scoring is taking place now. The third-party evaluator, when it comes on board, or when it has been determined who it is, will probably also be taking a look at the process to review it, to make sure that it's following, it's appropriate and is fair for all individuals. But as I said, until that's put in place, the Department of Commerce is still moving forward, and will be planning at this point to make an announcement in early June, as to who those 40 processors will be. The dispensary program will be the one that's really probably more important to communities, as we see where those those dispensaries will land and what they will look like. There will be 60 selected, or 60 slated to be selected from the 104 applications that were received. The dispensaries will be awarded in May. This is out of the Ohio Board of Pharmacy will be making these selections. And so the process is completely different than the one that was put forth in the Department of Commerce, because they're two different agencies, two different processes. So while they may pay attention to what the third-party evaluator may come up with and may recommend, they believe their process is secure and adequate, and it's not the same. So they certainly are going forward with the process and will be making awards for those dispensaries in May. As it turns out, from the application process, there's a very distinct design of how these will be distributed across across the state. There are 4 regions, and within the regions there are districts that will set up how many dispensaries can be in that location, just to make sure that the state is completely covered. Unfortunately, out of the 60 different districts that are locations that were determined, only 57 have received applications for such distributions of dispensaries. So there will only be 57 at this point in time, and as next year rolls around, or the new period for looking at dispensary rolls around again, they'll look to see if there'll be those who want to apply for those 3 districts that did not receive any at all. So there will be 57 awarded in May, and we'll see how that looks. You can go to, I've put on the PowerPoint here, medicalmarijuanaohio.gov, and you can go into that website and look for where those dispensary districts are to understand how many will be in different county regions to fill the need of the applications for dispensaries. The physician piece of it is moving along too. On April 11th, which is tomorrow, the Ohio Medical Board will be having a meeting, and right now there are 40 to 50 applicants for the licensing of being able to certify to recommend marijuana. This will be an ongoing process in the state of Ohio, so the physicians who feel like they want to recommend marijuana will make their applications to the Ohio Medical Board, and at their regularly scheduled meetings, they will be looking at those physicians. So there's no limit to how many there can be, and where they are located, it's a matter of how many physicians wish to apply for this certificate. They will require 2 hours of training as they prepare to apply for this licensing thing. And the licensing thing is the CTR, which will be at the end of their credentialing pieces of it, which basically means a certificate to recommend. So tomorrow we could by the end of tomorrow, we could have as many as 40 to 50 physicians who are qualified to recommend marijuana to their patients. In light of all the different pieces that have come up over the years, over this year, with the problems of cultivation and the process of putting this program together, Senate bill by Senator Coley has been introduced. It's Senate Bill 264, and what this is it would allow the legislation to suspend the medical marijuana program until the state auditors had a time to review all of the scoring process. And at that point in time, the auditor, if this bill should move through the legislature and be passed, would require 30 days for the state auditor to review all of this, and then an additional 30 days for the Department of Commerce and the Board of Pharmacy to implement any of the recommendations that they feel is necessary to improve the system and make sure that it's fair. This bill was introduced to take a look at the appeal process, not to take a look, but in response to the appeal process of the 70 different individuals who felt it was unfair. Right now, that bill was introduced on February 22nd, which was now probably 6 weeks ago, and nothing has been done. It has not even been referred to a committee, and there's been no hearings scheduled. So while this is on the radar and people are looking at it, it certainly is not something that seems to be moving forward that will jeopardize the medical marijuana program as it moves forward. So those are the highlights of what's happening in the state of Ohio right now. There's certainly many more things as you've been reading your legislative updates, but we have decided that we could open that for questions. If you have questions about any of these things at this point, I'd be glad to answer them for you.
We don't have any questions right now, Marcie, but I do want to ask you, it seems like Ohio might always be in election season, but we are actually in the middle of an election season. And is there anything that when we go back to our communities, that we can do to make sure that public health and that the issues with substance use and misuse and abuse are front and center as we get ready to host these elections?
Yeah, I would encourage everyone in their own communities to look at who's running in their community and engage that individual or find out from that individual what they really know about these issues and what their stance is. Just engaging with them, talking about them, educating them is the biggest piece. Is to educate them is not lobbying, and it's not going to get you into trouble. It's when you take a stand and endorse a candidate that becomes problematic. But education is part of what we do and what we should be doing. So engage those individuals who are running for office, find out what they believe, what they stand for, help them and guide them with information that will help them to understand the issues more directly so that they come to the state house, if they are elected, primed and ready to engage in good legislation and good bill processing.
Just one more question then. It seems like a lot of the people filing complaints or threatening lawsuits are people who were not awarded licenses. Are you aware of anyone that has been awarded a license that has complained that the process is unfair?
That's a good question, and from mine, but I'm not 100% sure. But while I'm, fairly sure that no, this is for individuals who did not receive it. This is actually very predictable, I would say. We have found this happening in other states as well, that this is a unique business. It's a unique business model. It's brand new, not only in the state of Ohio, but in the nation as well. And so these entrepreneurs are looking at every angle of it to make sure that it's a wide open market. And generally speaking, we're not finding that when we have a very structured system like the state of Ohio has, that it's met with open arms, because everyone wants a piece of the pie, as they say. So we're finding that this is usually for people who have not made it, that feel like they want it, they've got a good business model, they feel like they should be a part of it. But the system as it stands right now in the state of Ohio is a closed system. It's being put together very tightly and regulated very tightly, which we feel is appropriate for a new business industry in the state of Ohio, especially around something that it has been an illegal and remains an illegal drug at the federal level. So we want to make sure that we're judicious and handle it as most appropriately as possible.
All right, thank you, Marcie. With that, I don't see any other questions, so we will go ahead and end a few minutes early. Thank you all for joining us for this webinar. You will receive an email with your certificate, and a copy of this webinar will be posted to our YouTube channel at Drug Free Action. If you have any questions, please don't hesitate to email us at contact@Prevention Action Alliance or give us a phone call at 614-540-9985. Thank you all very much for joining us this evening or this morning. I hope you have a good rest of your day. Bye.